Welcome to the viewing and listening audience to this, the 11th meeting of the Joint Select Committee on Social Services and Public Administration. This is the committee's second hearing with stakeholders pursuant to its inquiry into the mental health and psychosocial services available to the population during the COVID-19 pandemic, with specific focus on measures to curb substance abuse and suicides. Members of the public are invited to submit their comments on the Parliament's social media platforms, YouTube channel ParlView, or via our Facebook and the Twitter pages. With us today are the stakeholders, the Office of the Prime Minister, Gender, Child and Gender Affairs, or Gender and Child Affairs, the Children's Authority of Trinidad and Tobago, the Association of Psychologists of Trinidad and Tobago, Elders and Associates Trinidad and Tobago, Trinidad Tobago Depression and Suicide Foundation, and Lifeline. At this time, I'll invite members who are with us to please introduce themselves, starting with Member Beckles.
Good morning, Chair. Good morning, everyone. Penelope Beckles, Minister of Planning and Development, Member of Parliament for Arima, member of the committee.
Member Monroe.
Thank you, Chair. Good morning, Chair. Good morning, members. Roger Monroe, member and Member of Parliament for Toko, Sangre Grande. Thank you.
Member Singh.
Good morning, Chair. Good morning, colleagues. This is Avinash Singh, member of this committee and also Minister in the Ministry of Agriculture, Land and Fisheries. Good morning again.
Member Naked.
Good morning to everyone. Look forward to a productive session.
Thank you, members. We will have Member Esmond for joining us in process, and we have excuses from Member Vandana Mohit and Member Rohan Sinanan. The inquiry has four main objectives. One, to undertake a preliminary examination of the trends in mental health and mental illness during the COVID-19 pandemic, to evaluate the efficacy of the support systems and services of the state aimed at counteracting the adverse effects of the COVID-19 pandemic on mental health and wellness, to evaluate the adequacy of support systems and services available for persons in the areas of substance abuse and also suicide prevention, and to evaluate the mental health support provided to healthcare workers rendering treatment to COVID-19 patients. At this time, I'd like to invite our stakeholders and the persons leading their teams to issue brief opening remarks, starting with the Permanent Secretary in the Office of the Prime Minister, Mrs. Jacinta Bailey-Sovers.
Good morning again, Chair and members of the committee, officers of the Gender and Child Affairs Division with me, and the National AIDS Coordinating Committee, Secretariat, the Children's Authority of Trinidad and Tobago, and members of the public viewing the session. The Gender and Child Affairs Division and the National AIDS Coordinating Committee are committed to serving the needs of society through the implementation of their respective mandates. We are happy to be a part of this session this morning to provide information and to also receive suggestions on how our services and systems may be improved. The Gender Affairs Division is the national focal point for gender and development in Trinidad and Tobago. Its mandate includes the promotion of principles of gender equality and equity through gender mainstreaming, including the development of gender-sensitive policies and programs to promote the equitable advancement of men, women, boys, and girls in all spheres of development. The draft National Policy on Gender and Development, which guides the work of the division, addresses mental health under the thematic areas of gender-based violence, health and well-being, and gender and special interest groups. The Gender Affairs Division has oversight responsibility for the National Hotline for Domestic Violence 800 SAVE, which is managed by an NGO on behalf of the division, and also oversees the sole government-operated domestic violence shelter, which, among other things, provides psychosocial support for survivors. The Child Affairs Division has coordinated responsibility to ensure the rights of children are promoted, protected, and respected, and is guided by the National Child Policy 2020 to 2030. The division's work is primarily related to policy development, sensitization, and education. The National AIDS Coordinating Committee and its Secretariat coordinates and monitors the expanded response to HIV/AIDS to achieve the goal of ending AIDS by 2030 in Trinidad and Tobago. The work of the committee is guided by the National Strategic Plan for HIV and AIDS. The National AIDS Coordinating Committee utilizes the mental health resources available through key ministries and NGOs to support the mental health needs of persons living with HIV. And in December 2021, the committee relaunched the HIV helpline.
Thank you very much, Mrs. Bailey Subas. Are you completed?
Just one piece of information I'd like to bring with respect to the issue of substance abuse, Chair. Just to indicate that the Division of Gender and Child is also treating with the establishment of 2 drug rehab community residences for boys in Tobago, given that we recognize there are no such facilities for children to deal with drug use and abuse, rehabilitation. And we also partnered with New Life Ministries Drug Rehab to undertake a pilot project with respect to substance use and abuse of children in schools. So we could always provide a copy of that report for the committee. Thank you.
Please do. Thank you so much. Let's go now to Mrs. Rhonda Gregoire Rupchan, Deputy Director, Care Services of the Children's Authority of Trinidad and Tobago.
Morning. I am Vandana Siusanka Ali, speaking on behalf of Mrs. Gregoire Rupchan of the Children's Authority. Chairman Paul Richards, members of the Joint Select Committee on Social Services and Public Administration, representatives of the Division of Gender and Child Affairs, and members of the viewing public. Good morning. The Children's Authority of Trinidad and Tobago is pleased to have been given the opportunity to add its voice to the inquiry, particularly as it relates to the mental health of our nation's children. The authority is a specialized agency with responsibility for the care and protection of children who are at risk or have been victims of abuse and neglect. We advocate for the rights of children and work collaboratively with partners from all sectors of the community to develop solutions to rehabilitate children, especially those who come to our attention, so that their full potential is realized. The authority has been operational for the past 7 years. During that time, children have come to our attention either through the courts or via reports made to the authority presenting with a wide array of mental health problems, which present themselves as emotional and behavioral challenges. We are aware that the system in which we all operate has gaps. However, through an all-of-government approach, we can improve the outcomes for our children and their families. Today, we welcome the discussion in the hope that it sheds greater light on the issue of mental health, which is still very much treated as a taboo subject. I thank you.
Thank you so much. Let's go to Mr. Charles Collier, President of the Association of Psychologists of Trinidad and Tobago. Mr. Collier.
Thank you, Mr. Chair. Good morning, and thank you to you and to the members of the committee for the opportunity. We're really glad to be able to share some of what we as the Trinidad and Tobago Association of Psychologists have collectively experienced, and some of what we think may be of value in terms of the provision of mental health care and appropriate social support services. Through the pandemic, certainly, but I think I'm being presumptuous, but I assume that we're looking toward the direction that we go as a nation with respect to mental health care. I'm certainly grateful to have the opportunity to participate in that process.
Thank you so much. Let's go to Dr. Lucretia Gabriel, Chairman of Lifeline. Dr. Gabriel.
Mr. Chairman, members of the Joint Select Committee, others present, members of the public, ladies and gentlemen. Thank you for the invitation to present this morning. I would like first and foremost to express Lifeline's gratitude to those who have supported us and our work since 1978. Lifeline is dedicated to being there for those who are in imminent danger of taking their own lives. Suicide is a spectrum, and we concentrate on that extreme spectrum. We are listeners. We remain as anonymous as possible and to meet the needs of those who are in imminent danger of taking their lives. And I look forward to the discussion that we will have, and it will be a fruitful discussion. Thank you.
Thank you so much, Dr. Gabriel. And now to Dr. Patricia Elder, Founder Director of Elder and Associates, Trinidad and Tobago. Dr. Elder.
Yes, good morning. Thank you so much, Senator and Chair, for the opportunity to be here this morning. For the fact that we are still alive and kicking and prepared to serve. Briefly, a little bit about our organization, Elder Associates Limited. We've been around since 1993, providing primarily employee assistance program services to the population of Trinidad and Tobago at our 4 locations, of course, Scarborough, Tobago, Tacarigua, San Fernando, and Port of Spain. We provide EAP and other psychological services to the private and public sectors for a variety of human concerns, both related to work-related issues and personal issues. Our experience over the pandemic has been quite interesting because we've had to change our modality of service, primarily to one of virtual services. However, we noticed that the demand for services really increased over this period, even though the modality of service had changed. So we provide not only the counseling services, but also critical incident stress debriefings, where we used to go before the pandemic on site to provide interventions for staff and for the organization as a whole. In addition, we have had the opportunity to do what we call pre-employment evaluations of law enforcement personnel. And that's really interesting because we got to really introduce to the recruits the whole concept of mental wellness and health that would really affect their performance as officers. So briefly, that's what we're all about. And we're really, really happy to be here. Our clinical director, Dr. Brent Pereira, and our trauma director, Mr. Ronald Tegley, part of our team. We thank you so very much for the opportunity to serve today and to participate, Mr. Chair.
Thank you very much, Dr. Elder. And last but by no means least, Ms. Kezia Worrell, founder of the Trinidad Tobago Depression and Suicide Foundation. Ms. Worrell.
Hi, good morning, Chair, members of the JSC, as well as members of the public. My name is Kezia Worrell, and my team member Cheyenne and I will be presenting on behalf of Trinidad and Tobago Depression and Suicide Foundation. I would firstly like to thank God and the Parliament of Trinidad and Tobago for this opportunity to be a part of this inquiry. This foundation was established on August 6, 2017, and for the past 3 years, we have been committed to relentlessly provide support to the citizens of Trinidad and Tobago, especially during the pandemic. We do hope our input at this Joint Select Committee can contribute to the overall mental well-being and sustainability of our beautiful country of Trinidad and Tobago. Thank you.
Thank you so much. Just to remind persons on the committee and officials to please direct your questions and concerns through the chair, myself, and also to kindly activate the microphone in your devices when you are acknowledged by the chair and wish to make a contribution or ask a question, and turn it off when you have finished your contribution. And we are going to start. We have 2 members who will have to leave us a bit early today because they have commitments later on today. So we're going to start with them. But just before we do that, because of the sensitivity of the topics we're discussing today, we'd like to just advise of some protocols in discussing, in particular, suicide, in terms of not saying some phrases and opting for some other phrases, which are much more productive in this kind of space. First of all, we should not say successful suicide. We should say non-fatal or made an attempt. We should not say successful suicide. We should also say took their own life, died by suicide, or ended their own life. We should not say committed or commit suicide. We should say died by suicide or death by suicide. We should avoid the phrase at all cost, suicide epidemic. We should say there are concerning rates of suicide or clusters of deaths, because we understand that these kinds of discussions may be exposed to vulnerable groups in society. And we want to be sensitive to that in our discussions here this morning. We should also be avoiding descriptions of the methods and locations of suicide and sensationalizing suicide in any way, so that we're sensitive to the vulnerable populations that may be looking on. Just to give a sense of some of the data that we're working with, which is of concern, first of all, provided by Lifeline, which I found quite of concern. In 2019, Lifeline received 6 calls per day, and I thank Lifeline for this information. In 2019, 6 calls on average per day. In 2020 to 2022, that went up to 10 to 30 calls per day. The call lengths varied from 1 minute to, in one case, I believe, to 7 hours. The average length of a call was 30 minutes. The prevailing issue related to the organization was suicide prevention in those calls. The age group was between 20 and 78, with 82% of the persons being less than 40 years old. 65% of the persons who called were male. So that's some interesting information. In terms of the children, and these are also of great concerns, as provided by the Children's Authority, and we thank them for the information also. In 2020, we had a total of, unfortunately, 149. In 2021, 124. And 2022 to date, 33, bringing it to a total of 306. There were cases of reported suicide ideation, attempts of self-harm only, 144 in 2020. 3 reported cases of mental health challenges. In 2021, 6 cases of reported mental health challenges, reported cases of suicidal ideation and attempts at self-injury, 118 in 2021. And to date in 2022, 1 case of a reported mental health challenge and 32 cases of reported suicidal ideation or attempts at self-harm, which are statistics of concern. We will start with the Office of the Prime Minister, and I'll defer to our colleague, Member Beckles. Go ahead, please.
Thank you very much, Chair. And let me again welcome everyone who's attending this session, as well as members of the public, and specifically to the Office of the Prime Minister, Gender and Child Affairs. I want to refer you to your submission that stated the Office of the Prime Minister, Gender and Child Affairs acknowledge the imperfections in the mental health services available to our core clients, and that submission is at page 7. And therefore, my question is, what are the main imperfections in the mental health services from the perspective of your ministry?
Thank you very much, Member. essentially, when we looked at the mental health services, we in terms of children, some of the areas of gaps had to do with certainly long-term kinds of facilities for children who need mental health support services. So as it is right now, we are working with the Ministry of Health to provide that type of facility. The Cabinet has agreed that some provision will be made at Montauk for a few beds, but in terms of long term, we will work with the Ministry of Health to set up a facility for long-term care for children who have mental health issues. One of the other areas has to do with the collaboration. We do feel that there is room for tightening the collaboration between the various institutions and ministries in the sector treating with the mental health issue. And one of the key factors has to do with ensuring that we have the robust protocols that will enable us to know who is responsible for what and who will take up that responsibility and at which point in time as the case management is done for the children. So those are some of the main areas, and of course one that is a common thread through a number of the areas, it has to do with the data collection and strengthening the data collection systems across the ministries and the institutions treating with women and children in particular, because that's our remit, and of course mental health support to those vulnerable groups.
Okay, thank you very much. And I'd now like to ask an additional question. So your submission indicated that the Office of the Prime Minister and the National AIDS Coordinating Committee, you incorporate counseling services as one of the core services to support mental health persons living with HIV, and that's at your submission, page 4. So can you indicate in the Office of the Prime Minister's estimation, what was the number of persons living with HIV who accessed these counseling services during the COVID pandemic? And can you also indicate, do those figures represent an increase in the demand for counseling services?
So, as mentioned in my opening statement, the National AIDS Coordinating Committee will have recommenced the helpline for persons living with HIV in December 2021, and to probably give a bit more detail with respect to the clients and what service provision have been made for the clients with respect to mental health services, I will ask Dr. Sebro, who is the director, to speak to that. Dr. Sebro?
Thank you. Yes. Morning, Minister. So, with respect to the service, from the perspective of the National AIDS Coordinating Committee, given its current role, mental health, the psychosocial support is heavily embedded in the new HIV policy. Beyond that, we would have re-established the HIV hotline, helpline in December to try and augment some of the services that would be provided through the health and social ministries to support people living with HIV. At this point in time, the service is just getting off the ground, and we will get about an average about 30 calls a month at this particular point in time. The scope of the helpline is a little bit wider than psychosocial support, so some of the reasons people have been accessing the line is varied, but this is one of our attempts to support the clients. In addition to that, our NGO partners have been doing additional activity to support clients. We had a town hall with some of the NGOs during the COVID-19 pandemic, and this was in an attempt to address some of the anxiety that would have come through from the clients due to the double trauma, then HIV and then the risk of COVID-19.
Member Beckers, you're still muted.
Okay, so one of the mental health initiatives of the Office of the Prime Minister, Gender and Child Affairs is that of the Child Zone, an online repository of activities, media and information on mental health and other child protection issues, and that is at your submission, page 5. So can I ask, what media platforms has the OPM Gender Child Affairs used to promote, advertise this Child Zone? Did the Office of the Prime Minister, Gender Child Affairs reach out to the Ministry of Education to promote the Child Zone in schools? And what has been the level of response to the Child Zone thus far?
Thank you for your question, member. I'll ask the coordinator of the Child Affairs Division, Mr. Moses, to respond.
Certainly. Thank you, Honorable Minister. With regards to the Child Zone, in terms of promotion, firstly, we have engaged in a series of promotions on all television stations, including special focus in Tobago. We've also done radio interviews. This happens every year with the major television stations and also the radio stations to promote it. We have also done our social media sponsored posts in collaboration with one of our partners, that's UNICEF, that would target all children and also adults in Trinidad and Tobago through funding of posts that are directed toward those who need it. And this allows individuals to click on the links and then visit the Child Zone and other related information. We have also been engaged with the Student Support Services Division under the Ministry of Education in collaborating on the introduction of the mental health workbook and the Child Zone into schools. So guidance officers were trained during the pandemic based on the statistics that we received around the mental health. And these guidance officers used the mental health workbook and also the Child Zone because children were attending school virtually. So they were able to log on to, of course, the website and download the mental health workbook and use it along with teachers or guidance officers in the classroom setting. And that allowed students to engage in that. We also printed, of course, copies, over 50,000 copies of the mental health workbook. And those were distributed and are being distributed to schools nationwide. At the back of that mental health workbook, there is a link to the Child Zone, and it lists all of the areas that are critical toward the development of the children. And we continue to promote it whenever we have campaigns. For example, we just concluded our Child Abuse Awareness Month, and we had a series of interviews where children themselves were on television promoting the website. So we continue to promote it in all of those facets.
Thank you very much. So your submission highlighted the Child and Adolescent Mental Health Plan, which will be implemented in 2022, and that will be done in conjunction with the Ministry of Health, as indicated by your submission on page 6. So can you say what are the objectives of that initiative, and what is the proposed timeline for the implementation of this initiative?
The division has been collaborating with the Ministry of Health on this particular project, which is also, I believe, a sub-project of the National Mental Health Policy. And we only recently started, I believe, Mr. Moses, to work with the Ministry of Health to promote this through our various constituents and the agencies that the ministry collaborates with. Mr. Moses, you want to sort of give some further information on this particular issue?
Certainly. So the plan focuses, of course, on scaling up the provision of access to our critical healthcare needs, reviewing the mental health policy to ensure that children's issues are also included in it, developing mechanisms and guidelines for the coordination and institutionalization of mental health plans, including that of HFLE, because we believe that we can use HFLE to also promote that as health and family life education. And of course, to address all issues and strategies related to mental health. And of course, the output of that would be the development of the essential mental health services plan, which is titled the development of a national child and adolescent mental health strategy, which of course integrates our social health policies related to child health, integral to address children's psychological well-being.
Thank you. I'm going to ask Member Beckles to put a pause there, and when the Children's Authority, we'll come back to the Office of the Prime Minister. We're going to go now because we're managing some conflicting schedules now to Member Monroe, who will address the Children's Authorities. We'll come back with more questions to the Office of the Prime Minister in the progress of our discussions today. So on now to Member Monroe and the Children's Authority.
Thank you very much.
Member Monroe, go ahead, please.
Thank you very much, Chairman. Good morning to all the agencies that are before us as a committee, and thank you. Good morning to the viewing and listening members of the public. Chairman, my line of questioning is directed to the Children's Authority of Trinidad and Tobago. Your submission indicated that the time frame for children requiring urgent attention at the St. Anne's Hospital was lengthened due to the requirement of children being required to have a negative PCR test. Could the Children's Authority indicate approximately how many children were affected by this delay in receiving the necessary attention?
Good morning, everyone. My name is Rhonda Gregoire-Rupchan. I'm the Deputy Director, Care Services at Children's Authority. Thank you so much for your question. I just wanted to elaborate a little more as well on the experience with respect to placement and children having to receive these tests. In order to enter a community residence as a safety measure, one of the things that we've adapted and have been complying to as much as possible is ensuring that we do the relevant tests, and that causes some level of delay to be able to get the results to have children integrated within the population. And also there's need for quarantine space as well to also have children then thereafter be integrated into the population. As for the number of children who have made attempts to enter St. Anne's facility, with respect to a COVID test, that is not a number that I have at hand at the moment. I'll be happy to provide that information for you in writing at a later point. But I would like to say that entry into St. Anne's has to, as we've indicated in our submission, channel through the accident and emergency at any of the hospitals. That's part of our referral process, depending on the presentation of the child, as well as through court orders, which will then facilitate the placement of the child in the facility at St. Anne's that is dedicated for acute care of children.
Okay, thank you. Could you tell me what was the approximate increase in wait time for treatment?
The approximate wait time, are you speaking specifically to St. Anne's or at all hospitals? Clarification.
Specifically to St. Anne's.
So the wait time for St. Anne's, it can vary between whatever time we have the positive test results to be able to go in, and what usually helps us to be able to have access to this facility with quicker time is when the order is made through the court based on the child's presentation. In that case, it is very quick in terms of getting the relevant support from the relevant agencies for the test, etc. Beyond that, we will have to wait until there is space. This facility is limited in space, so we wait for when there is space, and that can be anywhere from a couple of weeks to a month or so on average to be able to get that placement. And that placement, when we do have it, is just for acute treatment for 2 weeks, and the child is expected, according to that treatment model, to return to community, return to the place from which we would have taken the child to receive such service.
Okay, thank you. Next question. Your submission stated that the Children's Authority is responsible for administering psychological first aid to clients in need of this service who may be coping with a recent traumatic incident. What course of action does the CATT, Children's Authority Trinidad and Tobago, take when children are discovered to require immediate psychological intervention?
Okay, so thanks again for that question. When children require immediate psychological intervention, it will usually be based on 3 areas of inquiry that we would have done. It would have been based on the child's immediate presentation with respect to disclosures that they may have made with respect to suicide ideation or attempt. It may have been part of a multidisciplinary assessment, or it may have been simply based on a presenting behavior for the child or through the court. And essentially, what we do is make the necessary referral letters to be delivered to the accident and emergency department of the nearest hospital so that we can have the child evaluated. Usually the course of action is for an evaluation to happen. There's a determination as to whether the child needs to be warded or whether a referral is made to St. Anne's for further treatment. Where it is not acute, our next course of action will be to do a written referral to the client for any of our mental health services for children. For example, the child guidance clinic or stress clinics and so on, to be able to get that support in a less immediate way. And then, of course, referrals from the court. A referral is made, written, and provided along with the order of the court to be able to have access to these services for mental health. So we've covered immediate service, but I've also added for your interest, children who may have less non-acute as well as court-ordered intervention for mental health services.
Thank you for that answer. But could you tell this committee what are the requirements to administer emergency psychological aid with regards to parental consent or approval for those children?
Okay, so I'd like to clarify with respect to psychological first aid. That will be when we encounter a child that is in a trauma situation, and our first steps would be to treat with the immediate needs of the child, the safety needs, the physical needs of that child, and that will be part of the element for psychological first aid. There may be a parent who may be non-compliant or who may not wish to provide or to support the interventions that we require. We usually liaise with that parent and try to share information, understand their story, etc. But at the end of the day, what is critical is service to the child. And if it is necessary, we can take the child. The legislation allows us the opportunity to take steps in the best interest of the child according to Section 22. And thereafter, we can seek an assessment order to have the child receive further evaluations thereafter.
My next question is, it is my understanding that the Children's Authority, Trinidad and Tobago, liaises with NGOs and other agencies to obtain resources for children and their families. Could you please indicate the names of those NGOs, the main ones, and other agencies that the Children's Authority, Trinidad and Tobago, partner with?
So we have different agencies across the country that we tend to look to. Those would include religious bodies like St. Vincent de Paul. We look at areas like the Rape Crisis Society, who help us tremendously to provide therapeutic intervention free of charge for children. We look at church communities as well. We look at members of the NGO community who are building budding groups with specialized services. The authority, so we engage in a massive run through our communication department to liaise with these entities to bring on board some of these services. Also, we look at ensuring that we have the pathway to develop MOUs with these agencies or service agreements. So we ensure that the service that we get is one that meets the standards required for the child. We're also emerging in the authority upon, we're currently in the review stage and approval stage of a volunteerism policy, which will allow us then to explore skilled and willing persons to come into the authority and offer support to the children, one that we are looking at maximizing resources and using an all-of-country approach to support children. So that policy too is on the way, and it will allow us to even further reach with NGOs and other members of the public who are so skilled and have the time and willingness to support our children in that way.
Thank you, Ms. Gregory Rupchan. I know Member Monroe has to leave us for a short while. He'll rejoin us in a while, but I'm going to open the floor to the other members, Member Naked and Member Singh. But before I do, I have a question that I hope can be answered by both the Office of the Prime Minister and the Children's Authority. It may not necessarily reside in your remit, but do you think that there are challenges, and I'll start with the Children's Authority because we have Ms. Gregory Rupchan on the line. What are your thoughts on children being referred to St. Anne's Hospital, given the stigmatization associated with St. Anne's and parents' concerns about that? And that question also to the Office of the Prime Minister, Child and Gender Affairs, because I know for a fact that because of the despite the great work that St. Anne's does, because of this stigmatization over the years, parents and citizens are reluctant to be referred to St. Anne's. And I know Professor Hutchinson and others have been advocating for decentralization, which is happening. But just the referral to St. Anne's is problematic for both adults and children. I can start with Ms. Gregoire Rupchand on that, and what your thoughts are on that, please.
I'll be guided by what is in the best interest of a child. And that's a mantra that guides everything that we do at the Children's Authority, and it's the ethos of the legislation that carries us. So the interest of the child and what is necessary for the child will be critical. And if it is mental health evaluation or acute treatment for a period at St. Anne's, which is what is currently available for children, is the course of action, then we will take steps to pursue that. However, we do want to recognize that the child exists in a family setting. And so it is important to work with the family and share the information. Many times that psychoeducation with the family to help them to understand the need for the intervention has helped us to bridge any concern or any cause of the stigma associated with St. Anne's. And of course, caseworkers that have children that are assigned there will be working with the parents on an ongoing basis, as well as the children, and they should be involved in the goal setting for the child. So most times that referral should not be a surprise to the parent or the child, because it will be part of the ongoing evaluation process and information sharing process that builds the case plan.
OPM, any thoughts on the question I posed?
Chair, I would just simply agree with Children's Authority, because we at the OPM, we don't deal directly with the children in terms of referrals. Usually the children go their pathway through Children's Authority. So whatever Children's Authority would see as the best approach to treating with it, we corroborate with them. I would say though that the Ministry of Health is a ministry that we collaborate with, and we are very comfortable with the support that the Ministry of Health would provide through St. Anne's, and we understand that it would take some time for them to roll out their policy of decentralization, and that there is some stigma, but at the point where the child needs the support, we are in full favor with Children's Authority in terms of the path that they would take. So we don't have direct experience.
Thank you so much. Member Naked, any questions to the OPM or Children's Authority?
Thank you, Chairman. Yes, I do.
Go ahead, please.
For the Children's Authority, you stated emphatically that your main concern was the welfare of the children and so forth and so on. This is not an aside. It's not something tangential, but I think both the chairman and the members, there have been certain cases in the recent past that where we saw some lapse, whether in security or maintenance of the kids. Just a question before I go into my formal question. Has these been security lapses? Have they been addressed?
The authority is definitely addressing all of the concerns in relation to any gaps throughout the process, including, and quite importantly, any security issues that we may be having. Specifically, we are working on ensuring that our children have adequate supervision, as they have been, and as we continue to do so, and our service delivery evolves, we continue to make sure that we have at the forefront any risk assessments that need to be done to make sure that we provide for the safety and security of the children in our care, as well as who we are case managing.
Okay, thanks for that. Well, pretty generic statement, but in your care, I think you have how many children you have in your care at present?
At our child support centers, we currently have 55 children accommodated at the 3 centers in Trinidad and 6 of them in Tobago.
How many of those that you said 55, how many of those that you have diagnosed with mental health problems?
We have 3 of those children 2 females and 1 male child who have formal diagnoses that are currently at our child support center. Additionally, we have another 8 children, 5 males and 3 females who show symptomology of mental health concerns, but who we have continually received treatment for at the health centers and have not been referred to St. Anne's to have a formal diagnosis. This is something that we continue to pursue. And while I have the floor, I just wanted to also add on a previous line of questioning that one of the areas of greatest concern and need is for the development of a facility to be able to treat the children who have signs of mental health challenges, but who may need long-term placement and multidisciplinary treatment. While we do have our facility at St. Anne's, for which we are grateful, there is a need beyond acute treatment for 2 weeks or so, as the treatment team recommends. And so there's absolutely a need for children to have a place where they can go receive long-term treatment where necessary, and where possible, they return to community.
I love that answer. So then, of course, I would follow. Has there been any formal approach to the government to provide such a facility?
We have had teams from the authority been invited, along with the Ministry of Health, to look at a facility that was referenced earlier at the Mount Hope Hospital to accommodate such children. And we've also done site visits at another facility, and are very hopeful that this shall come into fruition before too long.
But I think the chairman, knowing how he would interrogate.
Are there timelines on that, Ms. Gregoire Rupchand? Are there identified timelines for that you referenced?
Certainly. The vagueness of the timeline specification simply comes from the fact that the development of the facility is not rested in the Children's Authority, but it is in the hands of the Ministry of Health. So we do await the feedback on the implementation of that facility.
Thank you. Member Monroe, you had a question?
Yes, Chair. Thank you very much. 2 more questions.
Go ahead, please.
Thank you. It's to the Children's Authority. Your submission stated that with regards to the provision of service to the Children's Authority, Trinidad and Tobago clients, discussion has been initiated with all other RHAs, regional health authorities, that is, other than the SWRHA, to formalize a similar MOU. Could the Children's Authority please indicate to this committee when did these discussions take place?
Certainly. So just to clarify, the authority has MOUs with NCRHA, which was originally signed back pre-proclamation before the Children's Authority formally came into being in 2015. And we have a recently signed MOU with SWRHA, which was done in 2019. Our ongoing discussions with the Ministry of Health to move our MOU discussions further have last met in September, as well as earlier this year in January 2022, to be able to push these discussions. Also, when an MOU is developed, we also have to operationalize it in terms of bringing the content of the MOU to the members of the team who operate on the ground. And so we have been meeting with SWRHA as recently as last month in March to be able to operationalize the MOU. Ms. Siusanka Ali, who is on the call today, led that team in meeting with SWRHA, and it was quite a favorable meeting.
Okay, thanks. Follow up. What further actions are required for those MOUs to be established in full?
Mm-hmm. So what we are looking at is continued discussions with the RHAs not mentioned above, which is NCRHA and SWRHA. All other RHAs, we are continuing to engage in discussions both at the operational level as well as the CEO level. We have had meetings, a very large meeting in September of last year with the Division of Women's Health and representing the PS as well. And so those are the kinds of discussions that we have been having. We are also engaging in a number of outreach sessions so that we ensure that what we discuss at the level of the PS and the CMOHs does in fact reach to all persons working on staff. And we have been engaging on a sensitization campaign. The last sessions, I believe, were done in Tobago in January, and we continue through our communications department to push that drive forward in the months to come.
My last and final question to you, Ms. Rupchan. I would like to know, based on a percentage, if you are in a position to share with us, this committee, in terms of the Children's Authority achieving their core mandate and goal when it comes to children in their care, how close you all are in terms of percentage to achieve that goal? The ultimate goal of making sure that those children in your care are in the best care. And I ask this because I represent a constituency, and we have throughout this country persons who will have concerns about children being in the care of the Children's Authority and wanting the best for them. So I want to know from your understanding, your full understanding, what percentage you all are at in terms of achieving your core goal and mandate to perfection.
Yeah. So our goal, ultimately, as you said, and I smile, is 100% because every child is really important to us all. However, the authority does have its challenges, and we are currently in the process of reviewing our organizational structure, reviewing our strategic plan. I've been in meetings as recently as yesterday afternoon, and I have one after this session where we look at the strategic plans to be able to build out our work plans to focus on getting to 100%. We are not there yet. I do not want to suggest a personal opinion as to where we currently are, but we are, with a new case management model, seeing great gains in terms of the number of children that we are reaching and the time frame that we are reaching them in this new model. So hopefully we will continue to work this, and our strategic plan will guide us specifically towards a closer meeting of that 100%.
Thank you very much, Ms. Gregor.
Thank you very much.
I see you evaded that trap of perfection very skillfully.
Thank you, Chair.
Let's go to Member Singh now, who will pose questions to the Psychologists Association of Trinidad and Tobago, or the Association of Psychologists of Trinidad and Tobago. Member Singh, go ahead, please. Is Member Singh there?
Thank you. Thank you, Mr. Chairman. And yes, I am here. Are you hearing me?
Yes, go ahead, please. We're hearing you. Member Singh, if you're having bandwidth problems, just take off the video. That will be all right. We're still having some buffering issues with you there, Member Singh. I don't know if you changed locations, but could you try that question again, please? All right, while we get that sorted out, I'll pose the first question to the association. In terms of how long has the TTAP been in operation, and what's your staff and HR makeup and volunteers like in terms of the association? What's your mandate?
The association was formed by an act of parliament in 2000. So this is our 22nd year in existence. We are an all-volunteer organization. The organization consists primarily of individual providers and small groups of providers who share the common practice of psychology. The staff consists entirely of volunteers. We have an executive that is elected, and we work through various committees consisting of members of the association.
Member Singh, are you back and are you able to move forward? Okay, let me pose another question to Mr. Collier and Member Singh, so those technicals. What has the association's membership been telling you about the pandemic, and what the interface with the public and the clients has been like in terms of the effect of the pandemic on the population?
Quite a lot, actually. As has been mentioned by others, there's a significant increase in the sheer volume of demand for services throughout the course of the pandemic. to the degree that many of our providers themselves, many of our members expressed being overwhelmed, and there was a need for attention to self-care, as there was a sort of transmission of the stress that was being expressed by members of the public who were seeking care. There were some notable presentations. There were some shifts in presentation. One of them was that in addition to just an increase in share demand overall, there was a distinct increase in the number of men who were seeking care. Typically, men are far more reluctant to seek care than women are. And I think that speaks to the effect of the pandemic in terms of overwhelming the resources of so many members of our population. There was also a distinct increase in the number of children who were presenting with various issues, a lot of which for school-age children surrounded their experience of schooling through virtual platforms, the anxieties that resulted from that. Many children do not learn well through the virtual platforms. But in addition, because of the removal from schools and the significance of social interaction in the growth and development of children, it often was particularly problematic for them. One of the places that showed up, I would say most disturbingly and dramatically, was in younger children. There was a spike that many members of the association reported in young children, toddlers, who were presenting with symptoms that appeared consistent with autism spectrum disorder, meaning that there were significant delays in their development with speech and with social interaction in particular. And there is still a lot of uncertainty.
Would you say that's highly correlated with their inability to interact with other children because of the isolation at home?
That is precisely the concern, that in many instances, we may not be looking at children who have actually developed autism spectrum disorder, but are in fact showing symptoms because they haven't been able to engage in the kind of socialization that facilitates their development at that particular age. And so it is our suspicion that over the next few years, as children are returned to the school settings and returned to avenues of socialization with each other, there may be a shift away from that trend and that pattern, not as a result of some deliberate intervention for ASD, but because there is a return to the socialization that more typically produces or facilitates children's development.
Member Singh, are you back yet? I don't know if he's hearing us. You mentioned earlier on, Mr. Collier, that Member Singh, go ahead.
Yes. Thank you, Mr. Chairman.
Go ahead, please.
I took note of the responses given to our committee, and in particular, your submission stated that the dominance of psychiatric intervention within the state system is a poor cultural fit for the population of Trinidad and Tobago, as there is a pervasive reluctance to use medications for mental health conditions, especially during the pandemic. My question is, what are some alternative culturally appropriate approaches to mental health treatment in Trinidad and Tobago? If you can share some of these examples.
Okay. So more broadly, there's sort of two things. I'd like to come back to the issue of the place of psychiatry in our approach to mental health care, if you will grant me leeway to do so. But more particularly, mental health care is not simply restricted to the provision of medical mental health care. Right? Psychiatrists are medical doctors who are trained in the medical treatment of mental health issues. And so their predominant response is the prescription of medications. It's an appropriate and reasonable response that is not to suggest that there's anything wrong with the provision of that care. The issue is that, I think other providers can attest to this, there's a widespread reluctance among the Trinidad and Tobago population to accept medical intervention in the form of prescribed medications. And as has been mentioned earlier, there's a distinct reluctance to institutional treatment in the form of being sent to St. Anne's or to other mental health facilities. And so there are various kinds of therapeutic interventions, behavioral interventions, talk therapies, changes in lifestyle, interventions may come through religious or other culturally valid entities, bodies, and mechanisms that people are more receptive to. And given that there is such a strong resistance to medication, it seems important to work with cultural organizations that contain elements of sound mental health care within their structures or practices or customs already, because there's a much larger or a much greater likelihood of actual compliance with those interventions, and therefore a much higher likelihood of the success of those interventions. Does that answer your question, or do you want something more specific than that?
Yeah, that seems to give us a lot of information in terms of the alternative. I also took note of your submissions where you indicated that the mental health professionals available. And I would like to get from your perspective, in your estimation, what are the main factors contributing to the lack of mental health professionals in our country?
Okay, that's an excellent question. And it's one of the big concerns that we have. And it's connected to the way that we frame and understand mental health care as a society. It's not an individual level issue. It is a societal consideration. Reference was made to the stigmatization associated with St. Anne's. And I frequently remark that our model of mental health in Trinidad and Tobago is binary. You're mad or you're mad. That's the way that we tend to view mental health. And of course, any even modest examination makes it clear that that's not an accurate or reasonable perspective of mental health, but it is very much entrenched in our societal narrative. And as a consequence, people who are in need of care, of intervention, of support and help from a professional are extremely reluctant to seek it, because for them, accepting the care, going to a counselor, going to a therapist, going to a mental health institution is interpreted as accepting the label of mad. And so in order to avoid that self-stigmatization, people frequently defer seeking mental health care until they have come to a point of severe crisis.
If I could just interject here, Mr. Collier and Mr. Singh, I just want to go back to the point you made earlier about the increase in men seeking intervention during the pandemic in the context of one, mental health care, but relatedly substance abuse, because that's part of our inquiry today. And we focus heavily on the mental health care aspect of it. But give us a sense of what the main, if you can, what the main complaints were, the main presentations the men were experiencing, that they sought out the mental health care, which is a good thing because men traditionally do not seek out even traditional health care. And what if there was information about whether or not a lot of that was in relation to increased substance abuse, alcohol and other drugs, etc.
Okay. I would say that it's the other way around. Frequently, we talk about substance abuse and we talk about it as again, from a psychiatric standpoint, as a diagnosis of a substance use disorder. But what we miss is the purpose of substance use. The use of substances, particularly when it becomes problematic, is functional. It serves a role. It serves a purpose. A few years ago, there was I found rather amusing song by Mr. Killer, in which he invited people to pick up something and run with it. The song began with a statement. The statement was, I had some stress, so I take some shots. The amount I take, it really hit the spot. That's the function. The stress is the Caribbean diagnosis, for men in particular, of emotional distress in any form. And one of our most common curatives, prescriptions, is alcohol. And so men in particular are prone to responding to their internal distress by drinking. And so during the pandemic, places to gather and drink were shuttered. And so for men in particular, a major source of their ways of coping was unavailable. And as a consequence, many men found themselves overwhelmed, unable to cope, because the way that they had been maintaining themselves and staying within the bounds of functioning were decimated. I think this also applies to the prohibition on access to outdoor activities. I think that played a significant role in the emergence of increased demand for mental health care, because that also has been an indigenous mechanism for coping with emotional distress.
Did your membership also give you any information on how the employment, underemployment situation during the pandemic played, or what part, if any, did it play in the men who are, in many cases, the breadwinners, seeking interventions?
That's a fantastic question, and absolutely. And so a lot of men found themselves out of work, and because we have sort of culturally coded definitions of manhood that include productivity and provision, as the heads of family and so on, for a lot of men, the loss of work and the loss of income is not just a matter of practical challenge, but also of psychological challenge. It undermines men's sense of their identity and their worth and value. And so it definitely exacerbated challenges that men were having. And that was expressed very explicitly, but it also showed up. One of the ways that it showed up was a notable increase in domestic violence, and in, even if there was not physical violence, domestic discord.
Fortunately, but somebody's mic is open and their dog is having a good time with us today.
That may actually be at my location, and that's not even my dog.
The issue of domestic violence is going to be the subject of our next inquiry, so that's good news. Before I go to Member Naked, if he has any questions to the association and Member Singh to wrap up before we go to Lifeline, do you get a sense that there may be some upside to this, because men who are not don't traditionally have a tendency to seek out intervention have now become clients? Do you think that trend will continue, which may be a good thing?
I think that men who engaged the process during the pandemic because they were overwhelmed, and who found some of the experiences that they had in counseling or therapy beneficial to them, are more likely to continue to seek care subsequent to the state of being in a pandemic. However, I cannot think of a reason why that would affect the overall culturally embedded pattern of men's avoidance of help. And I think that gets to the thing that I wanted to circle back to, is that throughout all of this, it has been appropriate, entirely appropriate throughout the pandemic, to have a focus on crisis care, on emergency care, on the treatment of people who are at risk in the short term of potentially losing their lives or of being harmed in other ways. It's entirely appropriate in a sort of triage sense to focus on that predominantly.
Were women's concerns in alignment with the men's concerns, or were they markedly different, those who sought interventions?
They varied. There were a lot of overlapping concerns. Both men and women shared a number of considerations that were not gender specific. There were particular things that showed up with respect to gender. In many instances, women bore the brunt of the expanded, I think in HR they talk about scope creep. Well, it didn't creep during the pandemic. It was scope sprint. And women found themselves being full-time employees working from home virtually, and being full-time caregivers to their small children, and being full-time teachers to their children, and being full-time caretakers to their elderly parents, and so on. And so a lot of women in particular found themselves overwhelmed by the immensity of what was being required of them under those conditions, and feeling no avenue of relief and reprieve. But what I was addressing was the issue of the way in which we approach mental health care. Crisis focus is appropriate, and I'm not suggesting that should be removed from attention. But if we only focus on crisis, then all we do is meet people at the point when they have become so overwhelmed, so harmed, so desperate, that we're able to help them out of the crisis and back into the place where they're just below the level of crisis. And so we end up with a population that in large part is functioning in a quiet crisis mode.
I'm going to ask you to put a pause here, because that's a discussion that we want to expand on. We have three other stakeholders before us, and we want to get their inputs also. So put a pause, because I want to get into that functional instability paradigm later on. But I want to go to Member Naked now and Lifeline. Member Naked, go ahead, please.
Chairman, with your permission, before I get to the questioning of the Lifeline, just a question for the OPM. Since I've heard several references to the stigmatization of the St. Anne's Hospital.
What I suggest, Member Naked, is if you could put a pause, because we're going to get back to them in the round later on, but I really want to get the other stakeholders involved, because they've been very patient, and we will get back to OPM on that question later on.
Okay. All right, no problem, Chairman.
Thank you so much.
So to Lifeline, I've been reading over the issues papers, and it's been stated here that you have a budget problem in getting an audit. You have financial problems in getting an audit, and that you haven't been able to get a cent from the state, and I quote, a cent from the state since July 2019. Is that correct?
Exactly. We do not have an audit problem. Somebody has done our audit, and it should be delivered any day now. The problem is that the previous one, we did not have the money to pay $5,000 per year to have our accounts audited. So somebody did it for us for free, 2014 to 2017. The ministry then waited 3 years before they tackled it, and then came back and told us, well, in the 3 years we waited, we want you to give before we will consider putting up for a subvention for you. We want you to give us audited accounts. But they knew that the person who done it pro bono for us had a stroke, and she was sick, and we did not have the money. We have found the money. The new auditor has, and you would not have heard of this pandemic, his staff were ravaged by COVID. So within the next week, we will get those audited accounts. That's no problem. We do what we have to do.
Well, I commend you for that, Dr. Gabriel. But then the obvious question is, what kind of subvention do you get from the government? To what budget you need? Yes, good. I like that. But let us know, what kind of subvention does the government they have you waiting since July 2019 for? Please enlighten us.
Mr. Dakid, it depends on what they decide to give. We gave them all the figures, and it comes if to supply a service that would meet the needs of Trinidad and Tobago, and we did it, would be approximately 1 million a year. However, whatever we're given, we will work with that. That 1 million a year, and I did the calculation. And when you say Dr. Gabriel, what you are saying, Dr. too, is that I see patterns in figures. I deal with numbers. That is my professional area. That's why I do not use it for Lifeline. That means that 1 million would represent 9.8% of the money required to run that service if it was done by the government. Therefore, when somebody makes the decision that they will not give us a cent and they will establish a government service, it is that in the name of the people of this country, they decide that they will spend $10 to get a service that they could have got for 98 cents. And I have the figures.
Wow.
So this is why I'm laughing. It's not a problem. We're accustomed to making do. Our focus is on those in crisis. And I agree with Mr. Collier that we should have an emphasis on those who are not in crisis. And let me apologize to Ms. Robinson, who I asked to join me today. We also are looking at that, Mr. Collier, and we're asking whether the government would look at setting up a multi-agency risk assessment committee, which would specifically concentrate on bringing the people who are at highest risk, bring the agencies that have to deal with them and collaborate such that the services would be provided. It would allow us to move out of the crisis situation. And that is why Ms. Robinson of Groups is here. We have done nearly 2 years' work on that.
Well, Dr. Gabriel, allow me to follow up, Brent. Since, and you are laughing, but I'm becoming angry. Since the government has been glaringly found wanting in this regard for such a critical, crucial service that you provide, has there been any attempt by your organization to source private funding?
Yes, we're actually very grateful that having made it clear that we are not getting any money, the private sector, which normally does not respond to our appeals, have done so. What we have is in essence the widow's mite. The people who will give us, and on a regular basis, are giving us 20 TT a month. And whatever we can do, we will make do with that service, because our concentration is on those at highest risk of taking their own life. That somebody has to answer that phone. It has to be done. If the government will support us, great. They won't. We are the nationals of Trinidad and Tobago. We make those decisions. Not we, Lifeline, we, the ordinary people of this country. Therefore, using the support of the $20 a day, or $20 a month, we will do as much of that service as we possibly can. It's not a problem.
Let me again commend you for working for so much with so little, Dr. Gabriel. But I have to ask you, some of the hard questions, of course.
Go ahead.
I've seen here in the issue paper that 90% of the callers suicidal, 65% of them were male. But
Yes.
I would like to ask, because we have the Children's Authority here, who has a budget that you would be envious of? I would like to ask you. I would like to ask you, Dr. Gabriel, how many of that 65% that are male, how many of them are young men? Yani, let's say minors, teenagers.
Those who are young men, those are under 20. It depends on, they're under 20. And we have always had a concentration on that since 1993. Lifeline has been around since 1978. So hardly anything anybody could ask about, we have not dealt with at some time. So, no, but the Children's Authority has its budget, and I hope very much that they will increase the budget that is needed for our children.
Well, Dr. Gabriel, and this is nothing, as you said, this is for the people of Trinidad and Tobago. And this is something I've worked on for quite a while, maybe half of my time since I'm in the Senate. And it works out that given the number of people within the jurisdiction of the Children's Authority, there's a budget for each person of $185,000. I worked that out and said so in the Senate on the Hansard, and that has not been disputed. So I would like to ask, is it possible for some kind of synergy between your organization and Children's Authority, that maybe some of that money that they so generously have, Dr. Gabriel?
Member Naked is a good question, but not for Dr. Gabriel.
For me?
Well, I'm asking her if she possibly, Chairman, as you would know, and I know you are aware also of the situation, Chairman, if she can possibly approach the Children's Authority to get some of that largesse that they seem to have.
Largesse is an implication that we want to stay away from, Member Naked. Let's not go down that
okay. Let's say generous contributions that they seem to have. I don't want it to get political, Chairman, but I am feeling angry, but I'm happy she's making me laugh. I'm fasting in Ramadan. And I will get annoyed quickly, but I feel her pain. She's laughing, but I appreciate
Mama Naked, the concern, because Lifeline has not received any money from the state since July 2019. It last received a subvention in 2015 and one time grant in 2016 to 2019. So
can we get those figures, Chairman? I know you always like to get specific, and I know you will ask. Can we get what was that last subvention? What were the numbers? So we have an idea.
Its last subvention in 2015 and small one-time grants between 2016 and 2019. To be fair, to put on the table, I do believe, and Dr. Gabriel can correct me if I'm wrong, the amendment to the NGOs Act makes it now a prerequisite for those audits to be done to receive state funding. Is that correct?
Yes, it does. However, and I think this is necessary to say, that you're grinding the most honest NGOs into the ground to demand it from them. If they put it in the act, then they should also provide for some mechanisms that the smallest NGOs would get their accounts audited. Because if you pay for it, you do not have the money. If you give me $50,000 for the year, and the money to pay the rent, etc., for the organization is $45,000. Where do you expect me to get the money from to pay $5,000 to have those accounts audited?
Well, I fully agree with you, and I understand Member Naked's intervention in that direction, because the amount of work I know Lifeline is doing, the funds don't align with the demand for your services. So I think something needs to be done. Some sort of discussion needs to happen. I know this is not necessarily the place, because we're here to talk about suicide intervention and depression, but it is material to your organization's continued functioning, given the role that you play and have played for many decades in Trinidad and Tobago. So that's why I think the discussion is material.
Yes, it's important.
It is, Chairman, because I have an anecdotal evidence of two former footballers who fell on hard times, who have reached out to Lifeline, and they said that it saved their lives. So this is something very personal to me, Chairman, as you noted. And I commend Dr. Gabriel, and I would like us to find, before we leave a break today, some solution to get this government to have an immediate subvention, given the surge in suicide attempts in Trinidad and Tobago and actual suicides. We need to have a solution, Chairman, else we are just talking in a committee every time.
I agree, Member Naked, and I think the point has been well made, and I agree that Dr. Gabriel and her organization and the ministries involved need to have some sort of discussion on how we can move this forward, because I think no funding for an organization like Lifeline, under these circumstances, even though it's a requirement of the amendment to the law, needs to be sorted out. So let's move on to the issues at hand. Final question for Lifeline, and then we go on to Elden Associates. Thank you, Elden Associates, for your patience, and also Trinidad Tobago Depression and Suicide Foundation. So, Member Naked, your final question to Dr. Gabriel, please.
Well, all the questions listed here, Chairman, pale in comparison to what we have just addressed.
Member Naked, Member Naked, I appreciate, and the point has been made and taken.
Okay, let me the final question.
Thank you.
Your submission stated that one of the weaknesses in the system during COVID-19 was that there was little help for persons who reside with mentally ill relatives, and there was a paucity of services to transport someone to a safe facility. The question would be, Dr. Gabriel, what does the organization recommend to the Ministry of Health for remedying this situation, given that they can't find a damn red cent for you all? Anyway, go ahead, Dr. Gabriel.
I would not link it to any funding to Lifeline. It is a general concern with the mentally ill. And what showed during the pandemic is the services, and I have said so, have been decentralized. And may I say this, having worked on this since 1978, you cannot imagine the real progress that has been made in that we could even suggest to somebody that it is possible they may need to go to see a psychologist or a psychiatrist. People will actually ring and say, I want to talk to a counselor, and you would say that. So, yes, it is that there is more that can be done. The decentralization made a difference, and nobody could have predicted COVID-19. And so they had to spin on around and do it. And so in future, they could look at it. It is something to be considered when somebody is in a lockdown situation with somebody who's having a mental meltdown. How do we get help to them in that situation? That is something that needs to be looked at. But I think that the mental health services, under the circumstances, did the best that they could.
Well, next time I suggest to you, before I finish, thank you so much, Dr. Gabriel. I suggest next time you make a carnival pod and get some of that piece of carnival money. Maybe they would have helped you.
Member Naked.
Go ahead, Chairman. Go ahead.
I appreciate your intervention, and I'm glad that you had such pointed questions. Dr. Gabriel, let me add my commendations to you and your organization for continuing to operate under the circumstances. I know for a fact, in addition to the work you do, you train young people in intervention very well, because I have a friend myself, I'll put on the record, who was trained by you, and because of your training, was able to access a very pivotal position in a U.S. NGO because of the training she received from your organization. So I know you're doing great work with training persons also.
Thank you.
Yes.
Thank you.
All right. Thank you, Member Naked. So we're moving on now and thank Elders and Associates for their patience. Let's get a sense from, I'm just trying to get the name right here, from Dr. Elder about the organization's experience, given what you've heard here. And thank you again for your patience, because we know we're trying to get through a lot of organizations today.
Yeah.
During the pandemic, in terms of persons coming to you for interventions.
Okay. Well, thank you, Chair. First of all, I really want to state to my colleagues in the field how deeply we appreciate what they do. Unless you're in it, you really do not know the kinds of challenges we face as mental health providers. So kudos to all who are here on the panel and who may be listening outside. Now, one of the points that was made by Mr. Collier, which I want to piggyback on, is the whole issue of help-seeking behavior. Yes, we have in the Caribbean a bias about persons getting, and Chairman, you said it too, getting any kind of help for their health in the institutions that we have. However, what we at Elder Associates note and we promote is prevention. We have a prevention focus, and we find that because our target population are employees of organizations that recognize the need for mental health and mental wellness support systems among their system, it gives us a doorway, an opportunity to educate masses of persons who ordinarily would not speak to a psychologist or a counselor or a mental health professional. But because we have the opportunity to enter the workplace with the permission of the owners, leaders of organizations, then we can educate folks about what it means to be healthy in a comprehensive kind of way, you know, mind, body, spirit kind of way. We also recognize, and I think Mr. Collier touched on it, that there are gender differences in terms of the need for support. And I'm going to say support rather than counseling or psychiatry or whatever, because mental health and wellness.
You became muted, Dr. Elder, for some reason. Could you unmute, please?
Okay. The technology is not cooperating with me. Can you hear me now?
Yes, I'm hearing you loud and clear. Go ahead, please.
Lovely. So the point I was making is that because we are an EAP provider, we have access to the population that is different than, say, some of my colleagues as they were speaking this morning.
Well, I'm glad you mentioned that. What then can you tell us about, because you are so involved in EAP,
yes,
employee support in so many organizations and agencies, what has the interface told you during the pandemic about the requirement for services and the type of services that you've been asked to intervene or provide support for?
Yes. So one of the challenges we faced was that we could not provide face-to-face services because of the pandemic. It would be too much of a risk, not only to the client, but to our own staff. So we had to mobilize our virtual platforms, which interestingly, many folks accepted and were delighted at it because of the accessibility of the service. So we had a pretty sizable number of persons who accessed us virtually. And we noted between 2019 and 2021 that there was a significant increase in the number of participants in our counseling sessions and the number of clients that we saw over the period 2019 to 2021. The number of crisis cases, as we call them, who would call into us and require what we call CISD participation.
What is a crisis case? What would constitute a crisis case?
Well, a crisis is anything you call a crisis, you know, because a crisis to me might be the fact that my dog died. The crisis to you might mean that it's the anniversary of the death of your grandmother who raised you. Or it might be an immediate accident or incident in the home, car accidents, or really any issue or event that occurs that really discombobulates your level of functioning, as we call it. Okay, that's a crisis. So we are not judgmental about what you call a crisis. If it's a crisis for you, it's a crisis that we need to attend to. Yes? So people will call in, and I hear Dr. Gabriel talking about people calling in and asking for counseling session. That is true. We have noticed an increase in people calling and saying, I need a session. Blankly, I need to talk to somebody. How soon I could talk to somebody. And with the virtual platforms, we're able to hook them up and provide that service as soon as possible, usually within...
What would be the main or the most frequently reported issues that you can tell us about? Calling?
It's interesting, Chair, because historically we noted relationship issues as the primary reason people will access the service. Why? Because it's acceptable. We all have problems in relationships. We still don't know how to get along with each other. So it's okay to walk in and say, I have a relationship problem. However, once the session...
Would that be intimate relation, although all are intimate in some way, or parental relation, collegial relation, or the gamut of all?
Okay, so you have the intimate partner relationships, you've got work relationships, you've got parent-child relationships, you got child-to-child relationships, human relationships across the board. But the most frequently reported one is marital or partner intimate relationships. Yeah?
And that increased during the pandemic?
And that did not change over the pandemic.
Okay.
What changed was the intensity of those relationship challenges, and also the introduction of what we call anxiety symptoms, where people are having difficulty sleeping, eating, etc., and also symptoms of depression was the other layer of issues that we saw as presenting issues. Yeah. So I don't know if Dr. Brent Pereira is also part of our team. And of course, as clinical director, he would get the direct responses or requests for services.
Absolutely, you can engage members of your team as you see fit, appropriately.
Great. So managers, executives, HR officers would call him directly and say, I need to refer employee X because we have noticed a change in their behavior in the workspace, or their whole demeanor or attitude or within the workspace that is affecting the level of performance. And then that communication will then give us the opportunity to call the individual employee and let them know that we are available to provide support to them.
Question, I don't know which of you, Dr. Elder, would take this question, between Dr. Pereira and Mr. Tegali. Is that pronounced right?
Tegali.
Did you have data or presentation of persons in work situations during the pandemic having problems transitioning to the online world? Because many of the unions would have told us in previous inquiries that had also been a challenge. Because of the emergency situation, many sectors had to transition to online in the pandemic.
Yeah. Brent, do you want to take this question, please?
Sure. Thank you, Dr. Elder. And in response to your question, Mr. Chair, so what we found is an increase in organizations requesting interventions to train their staff in how to transition, and both ways. So initially with the introduction of remote working, how can we support employees to transition and maintain productivity? And with the reintroduction to physical working, having sessions and interventions to train them to adjust back to that modality as well. So a lot of organizations have recognized the need to provide support to their employees to deal with not just the productivity issues, but on a personal level, maintaining that work-life balance.
Thank you for your response. Dr. Elder, you spoke earlier on of the increase in, or the increase in intensity in terms of the intimate relationships during the pandemic. What were some of the presentations? And do you think that we should still look out for some sort of continuation of that, even as the pandemic trails off into endemic stage and beyond? Because sometimes if the issues are not dealt with and they are raised because of a precipitating event, it may continue if not resolved or intervened.
Yeah, that's an excellent question, because we're looking futuristically at what may affect the employee or the client in the future. What has happened during the pandemic, as we all are aware, is that if we are in a family situation with partners and children and so on, and grandparents in the home, all of a sudden that proximity exacerbates whatever dynamic in the family system was already there. But we know that work for many folks is therapeutic, meaning, I can't wait to get out of the house, get to work, because it's a good diversion from all the trauma and drama in the house. So here the pandemic comes, I'm in the house with this partner, with this mother, with this father, with these children, and I can't escape. So the tension in the dynamic of the family increases. And thus you have the anxiety and the depression increasing also on top of your regular family issues, which every family can attest to. So what pandemic did, it really exacerbated whatever the current system in your family existed that you were probably avoiding. You didn't have to, I wouldn't have to talk to you if I didn't see you, but you're in the house every day. And we had some clients also who decided that they're going to change careers during the pandemic. So one fella said he always wanted to be a chef. So he's in the kitchen now, using up all the pots and pans, not washing them the way that his partner says he should. And that, again, acts as a trigger for more distress in the family system. So the pandemic really was an eye-opener, is an eye-opener for us in terms of our family systems and how we can help our citizens manage better in the future. But they must be aware, number one, that these issues exist and be willing to accept the support that is available through the EAP, if their company has one, or through any public clinic that is there, or any of the other support services that are there in Trinidad and Tobago.
Thank you. I'm going to put a pause. Thank you for your interventions. They're very interesting. We are going to thank Ms. Worrell and Ms. Riley for their patience of the Trinidad Tobago Depression and Suicide Foundation, and defer to member Avinash Singh for questions to that organization.
Thank you, Mr. Chairman, and good morning, or should I say good afternoon to members present here. To the Trinidad Tobago Depression and Suicide Foundation, in looking at your submissions to questions that we posed, when asked about the assistance and support that you all give to the population, I saw that you indicated recommendations and referral to seek professional help. Would you mind describing the referral system utilized by your organization, and on average, how many referrals are made per year?
Ms. Worrell?
Anyone from the Trinidad and Tobago Depression and Suicide?
Ms. Worrell or Ms. Riley?
Hi, afternoon. So usually how we make referrals is that we try to find out exactly where the client is located, try to direct them to either to the nearest health center or to the nearest hospital, depending on the severity of the situation. And based upon that, then if they actually go to the health center, then the health center would give them a referral to the nearest hospital. We get that very frequently at the cases where it is, if it is, we have to say per month, I could definitely say between 10 to 20.
And these come in via phone calls, walk-in, or referred by persons as well in society. How these referral, how these communication and how these data comes to you?
We both receive phone calls as well as we receive persons contacting us via Facebook. So Ms. Worrell will most of the times have persons receiving calls where I would more or less deal with persons via Facebook.
And in relation to the pandemic, what percentage you all can indicate that the numbers of persons seeking assistance increased during the pandemic when compared to previous periods?
I would definitely say that it has increased greatly. To give an average percentage, I would probably say it would have probably increased maybe by a 10%.
All right. And stemming from the discussions we've had earlier with another organization, I saw you indicated that you have not received any support financially from private sector, business community, nor the state since your establishment. My questions to this point is, has your organization approached these entities for assistance? And if the answer to that is yes, what was the responses? And if the answer is no, why hasn't your organization approached these entities for assistance?
May I redirect that question to Mrs. Worrell? She would be able to be to answer.
Good day again, everyone. No, the answer is no. We have not approached the government with funding our organization. I believe the main reason is, mental health in Trinidad and Tobago is it is stigmatized, and we sort of daunted on the process because, I honestly think it would be really long. Based on what Dr. Gabriel was saying earlier, the tediousness of actually going through that process of asking for funding seems a bit, long. So we prefer to...
So how do you all survive?
Well, we survive. We survive by the grace of God. We just, use social media.
How long has your organization been in existence, and what prompted its formation?
Since 2017. What was the second question? Sorry.
What prompted the organization's formation?
I didn't get that. Sorry.
What prompted? What was the reason that you decided to form the organization?
The reason it really came from a personal experience with me also, battling with depression. I sort of came to the realization that, you're depressed, but nobody doesn't really, understand really what depression is. And I think at the time too, I was around a lot of depressed people as well. And the fact that, people didn't really take us seriously, it sort of prompted me to create the page, to also assist people like me, as well as the people that, I was around at the time.
Did you find, because the organization was formed in 2017, you said?
Mm-hmm.
What, did you get persons responding to the page more during the pandemic, or was it consistent with before the pandemic?
Well, the page was always active. We always responded to people on a consistent basis, but it did increase during the pandemic. We started to get calls regularly. Usually persons will just, more communicate with us via social media, but people started to call a lot. People was really stressed during the pandemic.
And what resources does the organization have to remediate? Or do you refer them to other agencies like Dr. Gabriel's or elders, etc.?
Well, people sometimes request that we come to their home. So sometimes we do home visits, to counsel clients, like to just coach them on a day-to-day basis via telephone again, as well as social media, and as well as, just in-person visits. And I think like the in-person visits, yes, it was during the pandemic, but I think people felt more comforted with the in-person visits, knowing that, it was a pandemic and all these protocols were in place by the government to ensure, social distancing and whatnot.
Because of your own experience, what would you like to see happen? And of course, the subsequent formation of the foundation, which is the Trinidad Tobago Depression and Suicide Foundation. What would you like to see happen from a state perspective or from a national perspective? Let me not say state because that kind of refers to the government only, when it should be a shared responsibility. From a national perspective on dealing with issues related to suicide, depression, and mental health and wellness generally?
I honestly think we need more institutions because, everybody knows St. Anne's to be a madhouse, like anybody in Trinidad and Tobago.
Well, let me just correct it. It is stereotyped as the madhouse,
right.
But it's a mental health care. Yeah. So we're broadcasting, so we want to be appropriate in our language.
Yeah, so in Trinidad and Tobago, it's basically St. Anne's is stigmatized as a madhouse, but that's not the case. People on this committee know that that is not the case. And I think we need more institutions that will be able to, see mental health as it is. A lot of people face mental health issues on a day-to-day basis. Mental health could be anything from anxiety to depression to just PTSD. It could be so many things, and from a national perspective, I think we need to provide more institutions, as well as I think that more guidance counselors should be. I think guidance counselors should be in every school, actually, even on the workplace. Just be made more available to the public so that people could access these facilities, services. Not it can be something that you have to go pay for, like to go. Yes, I understand that therapy is a profession. Yes, you pay, but honestly, the average price to actually see a counselor, the average man wouldn't really have that amount of money to, pay, for 2-3 hours, on a monthly basis, or however the intervals may go. So I honestly think that the government should make these partnerships with NGOs, so that these NGOs could be funded, for their resources and whatnot, to make counseling and coaching / mentoring sessions available to the public, so that people could actually get the proper treatment that they need.
Ms. Worrell and Ms. Riley, I want to thank you. Your youth and your candor is greatly appreciated because I have a really visceral, emotional reaction to your presentation today. I really want to thank you for that. We're coming up on about 12 minutes to go before the end of this session. I just want to ask 2 quick questions to the OPM and the Children's Authority, and then I will defer to each of the leads of the teams before us to make closing comments. And one of the questions is to the Children's Authority and what has been the experience of the authority and of course, and also the OPM on the issue of children's experiences during the pandemic. And Mr. Collier, I also have a question from our audience to pose to you on the increase in cyberbullying and online trauma because children were locked away and transitioned even more to online experiences during the pandemic. So if the OPM could chime in on that one, and the Children's Authority, and I'll pose the next question so the other agency can get ready. What has been the experience of the Association of Psychologists on migrant population, particularly the Venezuelan population, seeking interventions because of the specific stresses they would have been under during the pandemic, having to migrate in emergency from a country in turmoil and not getting the most gracious of welcomes sometimes in Trinidad and Tobago, and having to fight for their survival on a daily basis. So you could start with because I think it's also an important part of our discussion this morning or today. So I'll start with the Children's Authority on the children's experience with online and the OPM. I'll start with the OPM, sorry. And what has the OPM's experience been regarding that? Because around the world, children were exposed to more traumas online because they were inside and online for greater periods of time.
Thank you, Chair. A lot of what we experience, as I said, because we don't directly deal with provision of services to children, so we do have anecdotal evidence in terms of what children experienced in terms of being online, the fact that they couldn't go outside sometimes when during the height of the pandemic, and how it impacted, their social interaction, the issues of the violence in the home, because the parents were also there, and we also heard that there were heightened tensions and so on. But to get some very specific feedback, Mr. Moses is going to give some insight into a focus group that was done with some children in terms of getting feedback from them, Mr. Moses?
Certainly. So we did a collaboration with PAHO, of course, with UNDP and UNICEF. And we participated in that activity by allowing children and young persons to share on their experiences. The report is still being prepared to be published because it's out of our control. But we got significant feedback in line with what our peers shared and what the others contributed on. But there were significant trends in terms of children seeking out help from strangers with their mental challenges, which is concerning. We also got feedback identifying that children felt a drop in terms of their school performance and being isolated from friends, which also caused them to experience depression. And they, of course, identified that they felt as though they lost a sense of hope in their future because they were not able to, of course, access education in the way that they would like, and they felt like they fell behind. Secondly, we also did a poll with our U-Report, which is a UNICEF platform that allows us to poll children nationally on issues affecting them. And 76% of children said that they felt more depressed or more sad or worried during the pandemic. And that, of course, led to the development of the mental health workbook as a direct response based on what they were experiencing as well.
Thank you, Ms. Gregoire Rupchand, from the authority's perspective.
Thank you, Chair. I'd want to introduce my colleague, Ms. Yusanka Ali, who will respond on behalf of the authority in this.
Thank you so much.
Good afternoon again. With regard to the online experience of our children, I would say as part of anecdotal evidence obtained through our case management process, as well as during the course of our assessments, we would have gotten feedback from children as well, similar to Mr. Moses' disclosure there, that a lot of children experience academic challenges and a sense of low self-worth and esteem as it relates to feeling that they could not keep up with the school environment, especially if they had diverse learning needs that were not being met through the traditional methods of teaching. A very important phenomenon that we also had to consider during the pandemic is more exposure to grooming. Because of the higher presence, online presence of children, and not always having the appropriate supervision in place, there were internet safety concerns that would have resulted in violence.
Absolutely, thank you. Go ahead, Ms. Ali.
Good afternoon, all. Yes, I am one of the psychologists at the Children's Authority that works directly with our client population. So what I would like to introduce is another aspect of what we're looking at, and I'm really here to provide a voice for our children. So yes, we did have children who were not taking too nicely to the online learning because, you know, for a lot of children, this removed the socialization aspect of school, which they very much enjoyed. But when we are talking about specifically with bullying, I'd like to provide an alternative approach. I had several clients who indicated that they very much appreciated the online learning because they were not being bullied inside of the school compound. So they were children who were actually experiencing bullying within the school compound. And now that movement to the online platform was very much a relief for them. So on the one hand, we had a lot of children who did not like the online learning for various reasons. But on the flip side, we had many of them who actually appreciated it for various reasons, including not being among peers who would have been bullying them. And then we just had some of them who were better able to learn online. So it's really multifaceted when we look at it. Of course, you know, we don't have specific data regarding these things, but this is just some of the experiences from some of the children that we work directly with at the Children's Authority.
Thank you. Mr. Collier, we have some questions from the audience. What should a parent do if their child is displaying ASD symptoms brought on by the pandemic? It may not be ASD related, but as you indicated earlier on, it may seem the lack of communication, the repetitive behavior may be in some people's minds analogous to ASD. And I guess this is for the Children's Authorities, but go ahead with your first answer, Mr. Collier, and also the answer on the migrant populations, please.
Okay, so with respect to the appearance of symptoms, the most important step is assessment. And the earlier that assessment is done with autism spectrum disorder, the better, because the earlier you have assessment, the earlier you can begin intervention. That might include speech therapy. It might include various other kinds of therapy. It should also include training in particular kinds of behavioral intervention for the parents, because the effective treatment has to be sort of a continuous lived experience rather than just a moment-to-moment periodic training. And so that's the first step is to get assessment. The second step would then be to follow through with recommendations with respect to intervention. And again, the thing that I would emphasize is the earlier, the better. With respect to the migrant population, it's a particularly it's near and dear to my heart because I did a lot of work with refugees and asylees and migrants in the past. And so there's a lot that's involved in simply being a migrant, being forced to leave your place of nativity, being forced to leave behind the places where your memories, your family, your history resides under dire circumstances, and go to anywhere else in the world is a deeply distressing experience. In addition to which, during the pandemic, although it was never expressed in an explicit way by any official, there was a lot of blaming and finger pointing with respect to the migrant population, accusing them of being responsible for the surges in the pandemic, with which came a lot of hostility and aggression from Trinidadians and Tobagonians toward members of that community. And so these are people who are outside of their land, disconnected from the people that they know and the things that they know, in a place where they are not first speakers of the language, different culture. It presents a lot of challenges, and I would like to defer to that because I want to use the word trauma to describe what's involved. And so I would like Mrs. Tappan Boxhill, who is the lead of our trauma team at TTAP, to say a little bit more about what those implications might mean.
Good morning or afternoon at this point. just wanted to state clearly that trauma tends to spike as a result of our lack of coping skills that we previously had, and whatever we had in the prior to the pandemic. Now with the pandemic, this creates a situation where trauma, the potential for trauma just spikes. So if we're talking migrant or we're talking the nation as a whole, we're recognizing that experience is very, very, is something that we can see across the board. Here's the problem that we as an association of psychologists, where we are teaming together to try to make sure that the level of care as concerned psychologists across the board, that we provide a particular level of care that helps the nation as a whole. We're recognizing, like Ms. Worrell says, that the average person finds it difficult to access that care because of the cost per hour of our services. So as an association, we formed a core group of individuals that chose to volunteer their services and form a trauma team. And that trauma team had been put into existence in 2008 when we saw a spike in the crime. And with the pandemic, it has become even more, we've had requests coming to us in greater detail. So as a result, what we find happening is that as a team, we would provide at least 3 to 5 sessions free. And we have been doing that consistently for those that have accessed the TTAB trauma team. The crisis intervention is one aspect, but to actually follow through with a therapeutic plan that deals with the root causes is so critical for us. We could take charge of certain symptoms that many psychiatrists will be focused on the symptom management, but on a psychological level, we're looking at the root causes of what causes that, and how can we even deal with the cognitive cognitive dissonance that is created because of the pandemic. So we're dealing with a deeper sort of work when we are working with clients. It has been, and I know that a number of those that have been a part of the team, we've had the pleasure of working with members of the community, not only with one-on-one, but also we provide free services to the community. We have been addressing community groups. We have been, and there will be a seminar that I personally will be conducting in May. I'm seriously, it is just a core group of us, but when we look at trauma as a whole, we want to make sure that we understand that individuals, even as well as the migrant community, are in a state where some of that traumatic experience of the pandemic is still hitting us all.
Thank you very much. I am way over time and the technical crew must be pulling their hair out now. So I'm going to have to ask each of the leaders of the teams to give us a very succinct closing comment, starting with Mrs. Jacinta Bailey-Sobers, PS in the OPM.
Thank you, Chair. And very succinct, as you said, the Division of Gender and Child, we were happy to be a part of this rich discussion, and certainly for the information that was shared, the suggestions for future action. And we have identified some modalities in terms of moving forward, certainly the protocols for greater collaboration, strengthening the system in terms of case management, and certainly data collection and research. So thank you very much, Chair.
Thank you so much to you and your team. Mrs. Gregoire Rupchan, Deputy Director, Care Services, Children's Authority.
Thank you, Chair.
I just want to say heartfelt thank you on behalf of the Children's Authority for being invited to share. Our takeaways from this, as PS said, very rich discussion is the need for placement and support for our children who are struggling with mental health challenges, even those who are coping well, so that we ensure that they continue to function. Highlighting the need for community resources and specialized discipline within our public health system is critical for us. And we really, at the authority, are looking forward to continued discussions beyond this JSC with some of our partners who we share similar experiences with coping with children who are, working through the pandemic and beyond. So thank you to everyone for having us.
Thank you. And maybe someone could have heard Member Nakid's call for some funding too. Dr. Gabriel. Let's go to Mr. Collier, President of the Trinidad Tobago Association of Psychologists. Had to give that plug there. Couldn't resist it.
Thank you very much for this opportunity to participate in this process, to hear from others from whom we've also been in many ways isolated during the course of the pandemic, and to see and hear the shared concerns about various elements of the provision of mental health care and our systems of mental health care and social support in Trinidad and Tobago. As we close, I just want to emphasize some of the recommendations that we put forward. And I suspect that Senator Nakid will be particularly pleased with the first and foremost of them, which is that we recommend that the state significantly increase the available resources for mental health and social services. That particular recommendation weaves through every other recommendation that we have. In the early discussion, the suggestion that funding from the Children's Authority should be shared with Lifeline underscores the pattern of us thinking in terms of how to spread the few little pieces of resources out between the multitude of agencies. And I think that to be a retrograde idea. If we are going to improve mental health in Trinidad and Tobago, then we have to invest in it. Thank you.
Thank you. Well, to be fair, I think that there was some line item for Lifeline in the budget. I think the issue needs to be resolved into how we can facilitate the audited statements from Lifeline by some sort of collaboration to get the funding to the organization to do its work. So thank you, Mr. Collier. Ms. Worrell. Ms. Worrell?
First of all, I would like to thank the JSC for having Trinidad Tobago Depression Suicide Foundation at this inquiry. We really do hope to see that, the government provides, more institutions, more facilities to facilitate persons who are mentally ill. We do hope that, our presentation on recommendations as well as our proposals are adhered. And we do hope that in the future we could probably work with the government in hand.
Thank you so much, and thank you for your personal testimony. We really appreciate your candor. Dr. Elder?
Yes, thank you, Chair. First, I am very, very happy for the opportunity for us to share our experience as EAP providers in this very, very important work, which is really everybody's business. Mental health is not just the government business. It's everybody's business. I think that the message that we need to always say is that help is available. Where we find it, however, could be different depending on where we are at. Support systems are there in various communities. We need to communicate to our people where they can get the help in a prevention attitude rather than waiting for the crisis, as some of our colleagues have mentioned today. There is also one other point I want to add, and that is care for the caregivers. We are so busy doing the work that we forget to really understand, I think Mr. Collier spoke of it, of self-care for the caregivers, because this work can be quite distressing at times. So supervision and support for caregivers in the mental health field, I think, needs to be on the agenda, in addition to the recommendation of expansion of the number of psychologists, mental health service providers throughout the length and breadth of our country are needed. We need to see health in a more holistic way rather than just medical. It is very clear that a holistic approach is absolutely needed in order to deal with our community struggles today. So thank you very much for the invitation.
Thank you, Dr. Allen. And just as a note, I had a question on specific challenges that older persons faced, senior citizens during the pandemic. We didn't get a chance to discuss that, but please feel free, any of the NGOs, agencies before us, to submit any additional recommendations and commentary on that and other issues to the Secretariat that we may include in our final report, because I think the elderly face some specific challenges during the pandemic. Dr. Gabriel, last but by no means least, I hope this is not an indication of the funding prioritization either.
Mr. Chairman, thank you very much. I have enjoyed the presentations. Thank you for the support from you and Mr. Nakid. It is refreshing. Thank you. What I would like to say is that Lifeline has always shared with other organizations. We recognize that we deal with people in crisis, but to do that, we must share with others, not take away from their budget, but aim and support them in getting the resources they need to do what they do best. Part of what we wanted to do today was to share extensively with you on the MARAC, the Multi-Agency Risk Assessment Committee. That has not been possible today, but we did submit the material for it. I thank my colleague, Dolores Robinson from Groups. And it is that we feel it is really that the MARAC would save lives and save money. It is about what each organization is allocated, that they would work together and save up to 70% of the cost on delivering the services they give, to starting with those who are at highest risk. So in conclusion, thank you very much for the support for Lifelines, getting funding to do what it does, but even more than that, giving me permission to ask that that also be done across the board for the to make it possible for us to collaborate and make good use of whatever we are given. And ladies and gentlemen, thank you very much.
Thank you. And because I know my media colleagues so well, I can see the headlines tomorrow. Lifeline on a lifeline. Anyway, thank you all so much for being with us today. We really appreciate your interventions and the time you took to be with us and share your experiences and your expertise today. The public is advised that the second report of the Committee on an Examination of Unemployment during the COVID-19 pandemic and the state's capacity to provide support to persons who became unemployed as a result of the pandemic was presented in the House of Representatives on April 22nd, 2022, and the Senate on April 26th, 2022. The report will be posted to the Parliament's website, www.ttparliament.org, where it can be reviewed and or downloaded. We'd like to thank once again our stakeholders for their participation and those who sent questions via our platforms for these important deliberations, committee members for their continued support and participation, the invaluable contributions of the staff of the Office of the Parliament for your procedural and logistical support, and of course the viewing and listening audience. On behalf of the entire committee, I'm the Chairman, Paul Richards. The meeting is now adjourned. Please be safe. Eid Mubarak to our Muslim brothers and sisters, and please have a safe weekend.
Thank you.
Thank you.
Hi, Chairman.
Bye-bye.
Yes, good day, members.
Thank you.
Thank you. Bye-bye.
No, I think they can hear.